Begin this morning, though, with a problem that is common to lots and lots of women around the country, but not many people are willing to talk about it. So we're going to break through that barrier today. We're talking about bladder leakage or urinary stress incontinence. That's the involuntary release of urine when you cough, sneeze, laugh, jump, move suddenly. And that's a big problem for lots of women. We're going to hear from a woman today who has gone through a treatment that is new in Fort Wayne and is having great success. So all of that coming up here on the HealthCall Live Radio Hour. And I'd like to introduce our guest, Dr. Marcus Jimenez from the Medical Spa. Welcome back to the program.
Thank you, Lee.
We're talking today about a treatment called Viveve that addresses a problem suffered by one of your members of your clinical team, April, who's with us today. Good morning, April.
Good morning.
So tell me about the problem we're addressing here is. It's the inability to control when you leak a little bit of urine.
Yeah, and it affects women more than men because the female urethra, the tube that connects the bladder to the outside, is quite short, and the tissues that support that urethra are delicate. And they can be damaged by just the years, the relaxation of the tissues in the female vagina, but also by childbirth. A lot of females find that after having children, this starts to become a problem for them, and it usually does become progressively difficult to take care of.
And April, we were discussing just a little bit earlier before the show started, guys just don't get this, do they?
No.
Tell me about the impact that it had on your life.
Well, it started about 5 years ago, where I started to use pads and having to change them more frequently. And a couple years ago, I just started to believe that this is going to be my new normal. But then Dr. Jimenez had talked to us about a machine that he was thinking about using, and we got it in December, and we did that procedure on myself, and I've had great success with it.
We're going to talk a little bit more about your experience, but let's get to this machine and the device, the treatment itself. It uses pulses of energy, radio frequency, to actually heat the tissue. And what's going on inside that tissue?
Yeah, I think the best things that we can do in medical science in the year 2020 is stimulate the body to heal itself. In the past, we used scalpels and sutures, and those still have their place for sure, but now we can stimulate the body to rejuvenate itself if we have a precise technique like Viveve. What Viveve does is it cools the mucosa or the lining of the vagina, but it also penetrates with radio frequency energy that heats that tissue to a specific temperature that can create this stimulation of restoration and rejuvenation. It was originally, and I got to tell you, I've never been more excited about a technology that we've brought to our practice, because I think it does have the ability to change lives. And the tissues originally were, the purpose was to tighten and restore a lot of the vaginal laxity that females might suffer after childbirth. And yet what they found was, with a lot of those patients, urinary incontinence that they were having, or bladder leakage, was improving as well. And that was such a huge thing for a lot of ladies that it was, that side effect, if you will, was much more beneficial than the original treatment.
So we're inserting a small probe that has a cooling surface so that you don't feel the heat, but yet the energy is passing through and deeper into the tissues, and it's heating the tissue enough to cause actually a little bit of damage that results in repair. Do I have that correct?
Yeah, I think controlled damage, micro injuries in the tissues that stimulate the body's rejuvenative processes, bringing new blood flow, new collagen, fibroblasts, tightening the area, and supporting that female urethra. I think it's been described as, so if my job was to kink a garden hose as it was lying on a waterbed, well, it would be difficult. If I put, say, a rolling pin on it and tried to press it enough to kink it, it would be difficult. But if you put that on this table and you try to kink it, it's much easier. So if you can tighten those tissues, all of a sudden the body's ability to create just enough of a kink to restore continence to a lady is much enhanced.
I was doing some research on this and came across a story, one woman sharing her experience, and she said she was just absolutely mortified being at a business meeting, and when she got up to leave, she realized she had left the chair damp, and that just froze her career. She said she was unable to go to additional meetings. She just had anxiety and fear and stress about being active in the business world because of this problem, and it's, as we discussed earlier, it's something guys just don't get a lot of. And you were telling me, April, that after your initial treatment, you noticed an improvement?
Yes, I did.
Tell me about that.
I was noticing that I could get up and I wouldn't have a lot of leakage, and I started to, if I sneezed or coughed or anything, I noticed that it wasn't like just a lot. And then over time, I'm about 9 weeks out. So I'm noticing that I'm not having to use as many pads, and it's kind of exciting.
That is great. And you don't mind me sharing, you're 39 years old, so you're on the young side for this problem, but it's not uncommon to hear of young women having this issue, right?
It's not. It's something that more commonly happens after childbirth. But as the tissues start to relax, as a natural part of our aging, it usually worsens. And I think the key to getting a lot of these women back to where they want to be in their life is just to overcome the stigma involved with bladder leakage. I think if we have a problem that's affecting 35 million women in the United States, a third of women after birthing age, and they're not getting treatment for something that can be socially debilitating, that the only thing that's standing between them and a better life is a stigma that in the year 2020 just doesn't belong.
Yeah, well, yeah. Let's talk about this problem. Let's get it solved since it's so simple, and that's what I want to walk through now. Tell me about this procedure. What's involved? How long does it take? Are there any limitations I'm going to face to activities or anything afterwards?
Yeah, first of all, I think they should, the folks should know that this is a very easy, well-tolerated procedure. It's comfortable. Patients have to be with us for about 45 minutes to accomplish the procedure, but it's able to be done by my female clinical staff. I think that makes them feel a little bit more comfortable with the procedure itself, and there are absolutely no restrictions. And when I mean no restrictions, you can resume every activity. You could go swimming, you can have sex that day. There are no restrictions on your activities from the second you walk out the door.
Okay, so the process is we identify that you have stress incontinence and not another type of incontinence, which is urge incontinence. That's not going to be addressed by this problem. So once we identify that it is a stress incontinence problem, tell me about the procedure and what happens in office.
Yes, so as you said, we're heating the tissues to a specific temperature that will rejuvenate and restore these tissues to their proper health. This is done with a novel device that has both a cooling and a heating element to it. So the surface is cooled to a specific temperature to protect the female mucosa, the vaginal mucosa, and yet that radiofrequency can penetrate and deeply and act on these tissues in a beneficial way.
And immediate response. April, tell us about your experience with this. I noticed that after I had the procedure done, immediate response is I noticed that I would get up and I would walk, and I wouldn't have that leakage. I've actually gone down from using 3 to 4 pads a day to like 1. And you said you used the 1 just mostly as a little insurance to make yourself comfortable. Yeah. And tell me about your test that you conducted last night. I think this is really interesting. Well, last night I went downstairs and jumped on our trampoline just for reassurance to see if I have been relieved of some symptoms of leaking, and jumped on our little exercise trampoline, and sure enough, I didn't have anything.
And it's been 9 weeks after the treatment, and you've got that kind of advance. Is there any reason to believe that it's not going to be long-lasting?
There's no reason to believe that it won't be long-lasting. I think, and the nice thing about this is April was a more severe case. And, she's had dramatic results in 9 weeks. These will continue to improve for probably another 3 or 4 months for her. And I suspect that the results will be very durable in her.
That's fantastic. Is there anybody who's not really a candidate for this treatment?
I think there are always folks that aren't good candidates, but if someone's having this problem, we can sift through that for them. I think the key is just sitting down and having a nice discussion and figuring out what's out there, and we can go forward after that.
Cost is always a concern, and these days most people are not accustomed to paying for something out of pocket. This is so new, and, well, we can get into a philosophical discussion about this, but insurance really doesn't care about this problem for women. There's just an issue with that, but we'll get another day on that topic. But, so this is an out-of-pocket procedure. How much does it cost?
Yes, so we're combining this with an in-home device that can augment the results. You take this home, you use it at your leisure, and you can continue to get even ongoing and better tightening of the tissues. So combined with the procedure, the cost is $26.95. You view it as an investment. Obviously, it's not a small amount of money, but if you look at that against how much money you're spending in products, pads, and something you can't put a dollar figure on, confidence.
Yeah, absolutely. Did you find that you were, April, limiting activities or anything? How did you plan for the problem you were having when you were out with the family?
Well, my kids love to go to Sky Zone. That's the trampoline place, and absolutely I would not jump on a trampoline at all. I try not to cough. I'd have to cough and cross my legs. It limited me on a lot of things I could do with my kids, which I think this has really been able to allow me to be more of a better mom to them.
Yeah, more engaged. Yeah.
More engaged.
April did this procedure on my mother-in-law just a few weeks ago, and she has loved to travel, and she had limited her travel to a significant degree to very short trips from her home in Indianapolis now because of this very problem. She's already seeing some dramatic results. I think this may change the last portion of her life to a significant degree. And, again, I don't know that I've had a technology that can change people's lives to this degree. I'm very excited about it.
Yeah, I get that. I mean, one single treatment and you have an immediate result that just gets better over the next few weeks. To have this kind of an impact, it does sound like a pretty remarkable kind of advance, considering where this procedure came from. I mean, surgery to cure this problem in previous cases was pretty nasty, right?
We are finding that with the advent of new technologies that we can start doing things for folks in a much better way with a lot less or no recovery time. And that's why this is exciting, because the alternative really wasn't an elegant solution.
Yeah, so here we have as you put it, an elegant solution, and I love the fact that it's one procedure, one time, and you solve this problem. That's great.
There's no question that there are going to be folks that are going to need touch-ups in the oncoming years. Our tissues continue to relax over time, even if we crank that clock back. And yet, this is going to be a spectacular result, and I think durable for a great number of folks.
If somebody is interested and wants to learn more, what's the process like, the timeline, and all of those things?
It's just a matter of finding a convenient time that we can sit down and discuss the pros and cons of the procedure with them. But certainly we are pretty efficient at getting people in the door, and we'd be happy to talk to them anytime.
Okay. And
that consultation is without cost as well.
And so a consultation and then follow up on an appointment that is less than an hour. You said you can do it over the lunch break if you need to, and he can get that out the door.
You could.
That's fantastic. How do I reach you if I want to know more? What's the best way to get to you?
You just give our office a call. It's 260-432-7654. And you can also go to our website, themedicalspa.com.
And I guess we should mention here that treatment is not only available here in Fort Wayne, but also you have a clinic in Fishers, Indiana as well, right?
We do. That's right.
So it's available in lots of places. And you are the first person in this area offering this treatment, I understand, correct?
We are. I'm sure we won't be the last. It's going to be a real wonderful opportunity for a lot of ladies out there.
Okay, so again, the treatment is called Viveve, and you can learn more by going to themedicalspa.com. Need to say thank you to our guest, April.
Thank you.
A member of Dr. Jimenez's clinical team, and then Dr. Marcus Jimenez. Good to have you back here on Health Call Live. Hope lots of people will take advantage of the information we offered you today and solve a problem that could be affecting a woman in your life. Share this information if you know somebody who's struggling, because chances are you do, and they're just not talking about it.